Cancer always begins with a small chain. A single cell that breaks away from the body's order and starts following its own path. Most cancers, about 80 to 90%, are carcinomas, cancers that originate from the body's epithelial tissues such as the skin, lungs, or intestines. The skin, lungs, colon, breast, liver, pancreas, all of them can become hosts to this type of cancer. The problem is that cancer cells don't remain confined to where they started. They spread through pathways such as the bloodstream or the lymphatic system to reach distant organs. This is metastasis, the very process that makes cancer far more lethal. The cells on this journey are called circulating tumor cells, or CTCs. For a long time, scientists believed CTCs were just byproducts of tumors. But now we know they are the main drivers of metastasis. If we can detect and analyze these cells, we can essentially predict the future of a patient's cancer, even before it appears on scans. But these cells are extraordinarily rare, sometimes only one CTC among about 10 million white blood cells in a milliliter of blood. Finding them was once like searching for a needle in a haystack. Traditional isolation methods suffered from low yield, poor purity, and limited sensitivity. In 2007, Professor Mehmet Toner and his team at MIT and Massachusetts General Hospital developed a device that changed everything: the CTC-Chip. This microfluidic device could directly analyze whole blood without any pre-processing and selectively capture cancer cells. Depending on the patient, the number of cells captured ranged from just a few to hundreds per milliliter of blood, with a level of purity that marked a major improvement over earlier technologies. Most importantly, the chip detected CTCs in 99% of patients with metastatic cancers of the lung, prostate, pancreas, breast, and colon. But science never stands still. Toner and his colleagues pushed the technology even further. The next breakthrough was the CTC-iChip, 2013, which could isolate CTCs without relying on surface markers. This allowed scientists to recover intact, viable cancer cells and study their genetic and phenotypic features in detail. Now, CTCs weren't just a number, they became a powerful tool to investigate drug resistance, monitor tumor evolution throughout therapy, and personalize treatments for each patient. The next step was the cluster chip, 2015. Sometimes, cancer cells enter the circulation not as single cells but as clusters. These clusters are extremely rare, yet their metastatic potential is dozens of times greater than that of single cells. The cluster chip was the first device that could systematically and efficiently isolate these fragile clusters, even those made of just 2 cells, directly from patient blood samples without the need for labeling. It was a turning point. For the first time, researchers could study intact, clinically relevant CTC clusters. This means we are no longer limited to invasive tissue biopsies. With a liquid biopsy, a simple blood draw, we can now track the course of cancer. These technologies allow us to monitor tumor progression, investigate mechanisms of drug resistance, predict disease recurrence, and tailor treatment to each individual patient.